Welcome to the Pharmacy Podcast. Join us as we delve into the dynamic world of pharmacy, exploring the latest trends, innovations, and insights that shape the industry. Our podcast is proudly brought to you by the Independent Pharmacies of Australia Group, IPA, dedicated to supporting independent and bannered pharmacies nationwide. We're committed to connecting all member pharmacies under the IPA national brand, recognized by Australians for elevating community healthcare to meet local needs. Our vision drives our mission to empower pharmacists and pharmacy professionals. From discussions on healthcare advancements and regulatory updates to interviews with industry experts and success stories from pharmacy professionals, we cover it all. Our goal is to inspire and equip pharmacists to thrive in today's ever-evolving landscape while championing the values of independence, community, and excellence. So, Karen, first up, I just want to say congratulations on your APP achievements, because you actually got the award, or Narrabri Pharmacy won the award for excellence in professional innovations for 2024. You're also the owner of two pharmacies. You own Narrabri Pharmacy and you're part owner of Carter's Pharmacy in Gunnedah. Now, Karen, I gotta ask you, that does not look like a pharmacy. You're not sitting in a pharmacy there. Where are you right now?
I'm actually in Newcastle today. So we do a lot of off-site vaccinations, and today we work with a company called Whitehaven, and they have a couple of offices, one in Newcastle and one in Sydney. So today I came down and did some COVID and flu vaccinations in their head office, which had a wonderful view of the Newcastle Harbour. And then I'll be looking forward to another view of Sydney Harbour next week when I go down for the Sydney trip.
Nice. That's amazing. Now, just a quick question, Karen, because we're going to take it back one step. I've been doing a bit of reading up on you, and you actually grew up and were raised in Gunnedah. And
That's
now,
right.
You now work there as well.
Absolutely. So, I grew up in a small town called Barnbar, which is halfway between Gunnedah and Narrabri. And my family had a farm there. So, and they still have that farm there. So I actually drive past my old home when I drive to Narrabri. So I live in Gunnedah, and I guess it all started when I was working in Sydney. So I did a Bachelor of Pharmacy at Sydney Uni, and then did a Diploma of Hospital Pharmacy, because I didn't think I knew enough after the Bachelor of Pharmacy, so I wanted to learn a bit more. And then worked in Prince Henry Hospital, which no longer exists, but I worked in intensive care and the renal ward. So that's always been a little bit of a passion of mine, kidney medicines. And then we had a family tragedy, and my mum was looking for a position for me closer to home. And I had done some relieving work in the country, but she'd been to pharmacies and asked if anyone was interested in getting a new pharmacist. And one such fellow was in Gunnedah, and he asked if I would be interested in, going into partnership. So that's how it all began with my ownership. So my mum sort of, got me my job.
Good on you, Mom. See, mothers are good. Mothers are good. So you are a mom as well, and you've actually made Carter's Pharmacy a family business.
Absolutely. So our business in Gunnedah, we have my husband who does the bookwork. So he's always done the bookwork for me. And Justin and Wendy are both pharmacists. And Justin came into the business 2 years ago. He did his intern year there, and then he bought into the business 2 years ago. So it is very much a family-run business. And Wen has taken on the hospital role, so she works in Sydney in a large hospital, and I'm her phone a friend, and so I get some hospital questions. So I have that place of working in like that hospital environment as well, and still, so I love learning, and so it's been wonderful. But yeah, my two children chose that career, which was quite surprising. But it's great. So we have lots of great conversations about drugs, I guess.
Did you inspire them, do you think? Or is it something that they grew up seeing? Because I know Justin started working in the pharmacy when he was 14, just weekend work, and he was doing like the bins and stuff like that. Or was it even earlier than that?
Probably earlier than that they were giving us a hand. So, it was mates rates on Boxing Day. It was probably quite early in the piece that they were helping out. But, I was giving someone a vaccination the other day, and he was an older gentleman, and he could remember when I took the babies to church, and so it was, and he said, there's one of them out there, which was Justin, So I guess growing up with my children in the pharmacy, people have sort of, resonated with being a family business, and now Justin's starting to look after those people.
It's actually really inspiring to hear that you're building a legacy. You're building a legacy within your community. You were born and raised there, and now your children are also going to be servicing the community. Pharmacy, I take it, has always been a passion, or is healthcare a passion for you? Or is the community a passion?
Well, I guess the community is a passion, and the regional health and the gap that we have is probably a passion of mine, and same with First Nations health. So I guess we try and bring services to our community that may not be available in the bush, and we want people to be able to get the same healthcare that they can get in the city. So sometimes we trying to bring other services. So we're always actively looking for things that can help make a difference to people's health in our community. So I guess we are community driven, and that is like looking at our area, seeing what the community needs, and then trying to, find that niche and be experts in that sort of area as well.
I'm going to tell you an inside joke, Karen. You are so immersed in what you do within the community, as well as signing up for all the health promotions and all the health activities that IPA has to offer, that in-house in IPA, we have actually coined it doing a full Karen when someone else signs up for everything. We're like, oh, you're doing a full Karen.
Well, name did get such a bad rap in COVID that
it's nice to see a Karen getting a good rap, right? Well done. Well, thank you for doing a full Karen every single time, every single year, because you do a lot. And that's what surprises me. You do. I must say, I've never seen anyone do so much when it comes to screening, heart health, all the health promotions, the vaccinations. You wake up at 5 a.m. sometimes, or you show up at mine sites to deliver vaccines at just ungodly hours. When some of us are deep in slumber, you're already putting a needle in someone's arm.
Yeah, so I think that's what we like, is taking the service to the people, because a lot of people won't have a vaccination if they have to actually go and line up and have it done. So I think having vaccination in pharmacy has made it a lot easier for communities to get vaccinated. But then some people still can't even walk into the pharmacy to have it. So sometimes we do have to go to those mine sites or the council buildings to get people to have a vaccination. And I had a comment from a lady this morning. She said, I couldn't come to the one last year and I couldn't be bothered going to get it myself. So I think sometimes we do have to, you know, try and take
Go the extra mile.
yeah.
Yeah, go the extra mile.
Yeah.
So 2 weeks ago, because I spoke to you 2 weeks ago when we were trying to organize a bit of point of care equipment for you so that you could deliver it in one of your pharmacies. And you were actually on the road to go to a mine site when I called. And it had actually rained, I think, but you were still making the journey. Do you remember?
Yeah.
What
So I
mine
think,
site was that?
pardon?
What mine site?
So I think it was around our area, the Narrabri, Maules Creek area. So yeah, sometimes we do have to go in sort of all weather. I guess I've always liked to get out of my four walls and do things differently. So I don't mind doing those extra things. So we actually have services out to Lightning Ridge, Coloranabri, Walgett and Brewarrina, and that's really rewarding as well. So that's with aged care, and we do medication reviews out there, but we also took vaccinations out there as well. So people are really grateful when you go that extra mile.
I was reading this morning some scary stats because at the present moment, flu vaccines are happening. And just looking at COVID and making sure that when we offer a flu vaccine, we're also talking about a COVID vaccine or an NIP vaccine. I'm going to read the stats to you. And can you, as someone who is in the space, walking in that field of going out there to give the vaccines, what tips and tricks can you give another pharmacist? But let me read the stats to you. So over 60% age 75 and over have not received a booster in the last 6 months of COVID. 75% age 65 to 74 years have not received a booster in the last year. 96% aged 18 to 64 years have not received a booster in the last 6 months. Now, I'll be very honest and say that I was quite shocked with the over 65s, because I actually thought that it wasn't 75% have not had a vaccine.
I think that there is a lot of hesitancy, especially with COVID vaccine, but even flu vaccine. So, I mean, the year that we did have COVID, I think we did around 2,000 flu vaccines in one pharmacy in that particular year, and then it dropped back significantly the next year. People were really interested in getting vaccinated for something, even if it was just flu. And then the COVID ones came out. But I think now we do have to go out and look for those people who haven't been vaccinated and really offer the service. I mean, we still have queries of can you have them both on the same day? And then we have the new shingles vaccine out, and that's eligible for anyone over the age of 65. So when we do get them in for a flu vaccine, we actually are looking to see whether they've had the shingles vaccine, and then we're offering it in a week's time so that they can have that again. So I think we as health professionals have to be proactive in that space and trying to get people to be vaccinated. The other passion that I have is the First Nations people, and we really want to get vaccination rates up in that area. So we've actually just been allowed to have get funding to have a healthcare worker from Healthwise, which is an institution which helps with First Nations health. And they're going to come to the pharmacy one day a week in Gunnedah and be like a liaison person for First Nations people, and that's going to start on the 1st of July. And that's just going to be an outside person coming in to help us to improve, some health outcomes. And they asked me what I wanted to get out of the program, and I sort of said, well, we want to try and get vaccination rates up in this population, because both Gunnedah and Narrabri have quite a high population of First Nations people. And I think we really have to sell it to them and try and get them to come in. So we know that the NIP for First Nations people, it's free flu vaccine. So it's trying to encourage those people to have it. And then another outcome would be to be screening particularly men who are not quite so active in the health space, in looking to try and prevent any health outcomes. So doing some screening in that area as well.
When you speak of First Nations, recently, I think it was at an APP or an AJP interview, you mentioned that you were working with the Immerse program, which is the improved medication management for Aboriginal and Torres Strait Islanders. Is that still ongoing, and are you still active in that space?
So the trial's actually finished, but I guess it was something that helped us highlight the huge gap that we have with First Nations health. So I did travel to Brewarrina during that study, and I was sitting down and there was a lady who was a similar age to me, and she'd already had a stroke and had diabetes. So it just sort of highlighted to me, well, you're the same age as me, and we have, a difference in our health. So I think we need to address these needs. But it was also good because we all, our pharmacists got cultural awareness training, so we sort of could understand, how to approach and engage with them in health. But we also now have a pharmacist who is First Nations, and she has been great to be like another liaison person for us with First Nations people. So I guess we don't segregate them. We've always had them in our store, helping them with their health. And we in Carter's we did a video for
community engagement. Is that the one?
Cultural engagement, I think it was, and we won the People's Choice for that. And I got one of my staff from Narrabri to come and video Gunnedah's store, and I thought I would have had to, line up people to come in, but they were all just there on the day. And I just said, oh, do you mind coming in this video? And, it was so easy because we had all of the people in our pharmacy anyway. So I think being active in that space, offering the free Indigenous dose administration aid, just being there for a chat sometimes is really important.
You brought up winning the People's Choice Award for the cultural engagement video competition that was held at APP. You've also done other videos, haven't you? Smith and Nephew comes to mind. And I think wound care is a passion. Wound care is a definite passion for you, Karen?
Definitely me. So years ago,
so do you just like sort of seeing pus or blood? Is that your passion? Pus and blood? What is it?
I do have a background in a farming family, so it was always this sounds pretty gross, but I would go over and watch Dad as he was cutting up a sheep and seeing all the different organs. So I do, I guess, like that sort of thing. But I went and did more training to learn about wound care. So I did a diploma in advanced wound care, I think it's called, through Monash, and that was really interesting. And I can sort of teach my other pharmacists, and they're also quite passionate about wounds. So, in our local area, we've always got someone who has a skin tear, so an older person who falls over, or we've got someone who's had a burn, or someone who's cut themselves, or they've come back from having stitches with the doctor. So we've always got wounds in front of us, and we just, offer the service. And one fellow yesterday came in and said, "Oh, I heard that you actually can take this cover off and have a look and then put another one on." And I went, "We do." So we got him to come in the room, had an assessment. We actually sent him to the doctor because it looked as though he had an infection. But we, triage those things as well. So, but it is a passion of mine, wound care, and we were involved with Smith and Nephew video. So we had a couple of our clients be in the video, and it was really rewarding for our team as well as for the customers as well.
Around wound care, are you there yet? Have you reached the pinnacle of where you want to be with the service, or is there more that you want to do? And do you even think that pharmacies can do more in this space?
I think that pharmacies can do a lot more in this space. We're still evolving, I think, with the wound care, and really it just depends on what we're presented with. So I think you just don't know what is going to walk in to the pharmacy, and I guess we also have a large range of different dressings to do. So, but we also talk to them about, nutrition and stress and resting and all of those sort of lifestyle things that, you would take for granted, but a lot of people don't realise that they need to up their ante on the protein, to help with wound care. And we're talking about, an elderly population, and some of them don't eat a lot of meat. So, we talk about, what they need to do to help with improving their nutrition so that they can help heal their wound. We've got a lady with diabetes at the moment, and we're dressing her foot ulcer twice a week. And, we talk to her about, trying to stop smoking. We talk to her about, having a snack of a protein bar, asking what her sugars are like this morning, just all of those things that are really important with, trying to improve the wound.
Karen, while you were speaking, I was reminded of when I used to work in the Kimberleys and all of the stuff I used to see come through the door, because you said you never know what's going to walk through your doors, and that is so true. So I've got two stories that I would like to tell you. So first one is this guy came in and he was like, "Oh, do you happen to have a scalpel?" And I was like, "Yeah, you know how there were scalpel heads that you could buy in pharmacy?" And I was like, yeah, sure, here you go. And he goes, "What about some needle and thread?" And I was like, "Stop, stop." And I was like, "What for?" He proceeded to produce his finger, and in his finger, he had a fish hook that had gone right through, and so was sticking out through the other end. And I was like, "Oh my gosh, you need to go to the doctor." And he's like, No, I'll just cut it here, pull it out, and then bring it back together. I was like, I think it needs a little bit more than that. So that
Melody,
was...
Can I interrupt you there?
Yeah, please.
That my husband had exactly the same thing happen. We were going to be going water skiing, and I went and bought a Wilkinshire blade and cut the hook out and then proceeded to go water skiing. He didn't ski, but we all did. But why?
So he was taking pictures while you guys were skiing with bandages on his one finger.
Absolutely.
I've got the other story is a doozy, Karen. So a guy comes in and he shows me his leg and he goes, "So what antiseptic can I use on this?" And so I'm looking at the leg, and along the leg on either sides, it's got holes, like holes along the side. So I'm like, what happened? Because I'm like thinking, was it a fence, a barbed wire fence or something? And he goes, "Oh, I got bit by a croc." And I was like, "Sorry, excuse me?" And he goes, "Yeah, I got bit by a croc. I tried to ride a crocodile and it bit me." And I was like, no, hospital now. And it's like, "Are you sure I can't just put some antiseptic?" I'm like, no. Antibiotic is what you need, hospital. True story. You can look him up on YouTube. Man tries to ride crocodile, broom. Like, I could not believe it. And it's very true. It's only when you work rural do you have these stories. Like, the stories are never ending, and like, story after story. So kudos to you, Karen, for actually stepping outside the comfort box that we have and going bigger and doing bigger and better. Do you think that there is more that we can do? And I also wonder, two questions here. Do you think there's more we can do when it comes to offering services in the pharmacy, especially for yourself, because you're so far removed from any other services? You don't really have, the quick nurse that you can rely on or the specialist that is available, number one. And do you think the public actually understands fully what we can do as pharmacists?
I think in rural areas they do trust us to be their triage. So I think we are the triage for the crocodile bite, or the dog bite, that sort of thing. So I'm really excited with the full scope and skin conditions coming soon for New South Wales. So I think, and also, we deal with skin so often, they show you a rash, all of that sort of thing. So I think pharmacy can do more, and I think that the public are seeing that. And people still do use their GP for vaccinations, but I think that is starting to shift towards more going to the pharmacy. So we're not taking away from the GPs at all. I think we're working with them, and obviously we triage and send them to the doctor because it's way too far for us to do. So I think in rural locations we do work well with our GP friends. The specialists, I'd love to see more telehealth so that people don't have to travel so far for their specialist appointments. So that would be, really great. And whether we set it up in the pharmacy, we have done that with a men's health consult with Brad in Canberra. So I think, utilising the pharmacy safe space for those appointments is also something that we can do. So, yeah, definitely more things. And I think our pharmacists like doing those extra things. So I think it's really rewarding. Just going back to wound care, this lady came in and said, "Oh, I came here and got it fixed." And another pharmacist who was just finishing off a vaccination in another room said, "That was me, Karen." So, we're all involved in it, and they love having those stories. So I think getting your team involved in the professional services is really important. And it brings some enthusiasm to your team as well.
Speaking of your team, before I forget, please say hi to Debbie and Leanne for me. Last I saw them was on the dance floor at APP, so please say hi to them before I forget. Because, I think Debbie, I've seen her a number of times at a number of events that we've thrown. And kudos to you for bringing your pharmacy assistants, your retail managers to as many events as possible, because it makes them feel as truly part of the team and embedded. So, yeah.
And
so,
I think, we love, going to different conferences. So we get other ideas from other pharmacies, but also from Instago as well. And, just all being together and throwing ideas around. And, we've all had problems. So it's great to go to a conference where you can find a solution for something that, we thought was so hard, and then there's an easy solution for it. So we try and engage with, our professional helpers, I guess you could call them, in different parts of the industry. And, going to a conference always helps with that as well.
Nice. Before I close, I've got to ask a couple more questions. Do you think your daughter Wendy is going to come and work with you? Or do you think she's lost to the world?
I think Wen will do her own destiny. So She's enjoying her residency in a hospital at the moment, so she's moving around different wards, and that's great. That was like our diploma of hospital pharmacy year, where we went to St Vincent's for cardiology, and then I went to St Vincent's for infectious disease. That was in the late 80s, and AIDS was really rife then. And then moving to Prince Henry, where we did cardiology, and then RPA for pulmonary sort of conditions. So I think, she's still, being a sponge and trying to absorb as much as possible. So I think that's a great thing. I don't know where she will end up. So I think, as I said, I don't think it'll be in Gunnedah though. So.
Fair enough. You mentioned something just now that you actually worked when AIDS was rife. And so you've probably seen the stages of the progression of how healthcare has changed, because back then there was so much stigma around it, and it was probably not as accepted and accepting, or even anyone who suffered from it wasn't as accepted within, and they didn't have a safe space in the community.
Like leprosy, really.
Yeah.
And I mean, my sister worked in St Vincent's as a radiographer, and she had to gown up, fully gowned, to just do an X-ray on these people. So, from there to now, what we have
is different. Because I come from Zimbabwe, and I don't know if you know this, but Zimbabwe has the highest HIV rate in the world. So for us, it's daily living. I mean, to the point where I've got family members who are infected. And so you can see the progression on how medicine has changed.
Yes.
Having said that, where do you see where we are today, and where do you think we'll be in 20 years' time?
Oh, that's a difficult question, but I think that we will be, we will still have some of the problems that we have now. So people ignoring their health and having some conditions that we need to treat. But I think that technology is going to help with a lot of our health conditions, and AI is something that is going to really transform healthcare, even just with the amount of studies of drugs and AI helping with that. I think there will be a lot of technological advancements coming. But in saying that, we still have to get people to actually take that pill to make that work. So, or do some lifestyle factors to actually improve their health. So I think that pharmacists will still be there in the health area, and we still need to be able to talk to people. So, I mean, we had someone with really high blood pressure, and I said to them, are you doing a 10-minute walk a day? Like, just something that can just make a little difference. So I think that we still need people in the healthcare area. So I think there'll be huge advances, but I think that pharmacists will still be there as part of the healthcare team to ensure that people, take their medicines, looking after themselves and doing the right thing. But definitely more technology. And, it's helping with me now from, 20 years ago. So I'm hoping that it'll help again in another 20 years.
So I've got two more questions. One comes from Georgia Wilkins, and she is a category manager here at IPA, and she focuses on vitamins and digestion. She wants, and you know her, Karen.
Yes.
You know her. She wants to know, when you retire from pharmacy, what do you hope Justin will continue doing?
I think the wound care services and sleep apnea services. Mm-hmm. So I think that that's probably my passion, and it's getting to be his passion as well. So I think ensuring that our community has solutions for wound care and for sleep apnea.
Amazing. Last question. ChatGPT. It is a custom that we ask ChatGPT to give you a question. Who is your mentor and why?
So Michael Flannery has always been my mentor. I went relieving at his pharmacy in Forbes when I first finished working at the hospital and doing some country relieving. So I guess he has been a mentor of mine, and I guess he lives and breathes pharmacy, and is passionate about rural health, and I guess I am following that sort of thing. But he does it in a way that is inspiring, but he's so down to earth, and that's where, I'd like to be. So, people can come and see me and not feel embarrassed about a problem. They can just come in and get some advice, or I will find someone else who will be able to help with the solution. So I think, Michael's a solution sort of based person, and I think, I try and follow with that.
He's also my mentor. Michael Flannery is also my mentor. He was actually one of the very first guests that we had on the podcast. He launched this whole concept. It was dreamt up while we were actually on the road visiting some of his pharmacies. And yeah, the concept of the IPA podcast was dreamt up in a car on the road visiting his pharmacies. So yeah, you're very right when you say that he is solutions-based. He has a heart for the community and a heart for patients and health. And he's not afraid to push the envelope that little bit harder. He's not afraid to work that little bit harder as well to get the job done.
Yeah.
So definitely. Well, Karen, I hope this was painless.
Yes, thank you very much.
Thank you for taking the time and actually doing it off-site in the middle of a busy working day in Newcastle. Thank you for your time. Go off and vaccinate some people, and don't forget to offer a COVID vaccine while you're at it.
Time for a walk along the beach. Thank you.
Nice. Thanks so much, Karen. At Independent Pharmacies of Australia Group, we're dedicated to supporting a network of leading independent and bannered pharmacies nationwide with a vision to connect all member pharmacies under the IPA national brand, recognized by Australians for elevating community healthcare to meet local needs. Thank you for joining us today on the Pharmacy Podcast. We appreciate your support in our mission to shape a thriving and patient-centric pharmacy industry. For more information about Independent Pharmacies of Australia, you can visit our website, ipagroup.com, or stay connected with us on social media. Thank you once again for joining us. We look forward to welcoming you back soon as we continue our journey together, enhancing community healthcare